Well, hi, everybody. Welcome to this virtual career experience with Inspire. Today, we have our special guest, and her name is Rebecca Tate, and she will be talking more about orthopedic nursing. And we're just so happy that she has given the time with us today. So, if you guys have any questions, feel free to ask any questions in the chat, and I will be glad to ask her those questions. And if you have anything that you want to get out of from this session, please let me know as well, and I will be able to facilitate that with Rebecca, and she will be happy to answer any questions that you guys might have. So welcome, Rebecca.
Thank you.
Yeah, so we'll go ahead and just get right in, and if anybody comes in late, I'll accept them in. But first of all, I just want you to introduce yourself and your role, and just share a little bit about your career journey with us.
Sure. So my name is Rebecca. I have been a registered nurse for 15 years. I did start my nursing career in a hospital. I worked on a medical and surgical floor, basically, or actually surgical and neurological, taking care of patients after surgery, along with taking care of patients after any sort of trauma. They all came to our floor. I worked the floor for about 3 years. Then I went a little bit more specialized to a orthopedic outpatient surgery center. I spent about 9 years in the PACU, which is a post-anesthesia care unit, taking care of patients after surgery. So primarily we started with all orthopedic, anything bone, anything joint related. And then about 6 years into that journey, we did start offering neurological services. So we had neurosurgeons from the two big neural places in our area. I am out of Appleton, that's where I'm working. So I did do PACU, taking care of patients for about 9 years. And then about 2.5 years ago, I did take an administrative role where I do chart reviews and basically make sure patients are all ready for surgery at our institution the following days. So typically I work for all the doctors, and I believe we started at 8 physicians, and now we're up to almost 20 between orthopedic doctors and neurological doctors. So that's my role currently.
Oh, wow, that's fantastic. Yeah. So for our students, what are some things that you think that they could do to prepare themselves for a role like this?
Sure. So a lot of people maybe don't know what they want to do when they're young, and that's fine. This is my second career. I did go back to school and get a bachelor's after I worked in advertising for about 4 years. But in high school, teens, early 20s, volunteering if you can. With COVID, I don't know what the requirements are, or if you can't get into places like hospitals. Nursing homes always take people. If anyone knows anyone at a senior community, that would be great. Also, I encourage every person to learn CPR. That's going to give you a good scope of what you can expect in anything medical. And if you really do want to get into medical, learn CPR. I really feel strong that everyone can learn that. Just basic life-saving. That's through like the American Heart. So you can look into that. Volunteering, or if you're 18, you can become a CNA, which is a certified nursing assistant. That's like a 4 to 12 week course, depending on like the duration you go during the week. So those factors, I mean, get in there and just, I think a hospital volunteering CNA work is really going to give you the information. Do you want to be in that position? Do you want to work with blood, body fluids, people at their worst? That is how I would encourage somebody to go into the medical field, go down that path.
That is so important to know. I know there are some people who have gone through college and then they realize that, you know what, maybe this is not for me. And it's a lot of time and money wasted. So that's really important to know that there are volunteer opportunities for students.
Yep. For sure.
Yeah. So with that, what are some skills that would be useful in this kind of role?
So with any sort of nursing, you've got to be tough. You've got to be able to stand up to physicians. The number one role for a nurse is patient advocacy. So if you don't think something's right, you have to be able to confront that. You have to be able to be autonomous. So working independently, you got to know what you're doing. At the same time, you've got a great resource of other nurses around you. So if you're supposed to be doing something that you might not know, somebody else will always know, depending on a procedure, medication, anything. So know what you're doing, but then also know that you will also have that resource from people. And you really have to be meticulous. Medication errors. I mean, if you're somebody who is very detail oriented, that's going to take you a far way as well.
Definitely. Take us through a day of your life. What do you do?
Sure.
Mhm.
So right now it's business more so it's not as important as the actual hands-on in nursing. So I don't really want to probably touch that so much. Maybe more people want to know about nursing and what that does with a patient, patient care. So a day of life in a nurse is coming in on your shift, not knowing what you're going to get. That can be in a hospital setting, that can be in a surgical setting, which is what I'm doing. And then you get patients as they come to you. You can't say, no, I don't want that. No, I don't want that. This is your assignment, be it on a floor at the hospital, be it at a surgery center. You're up next for a patient. So getting a patient in our role as a PACU nurse, it's taking vitals, making sure they're waking up, they're breathing after anesthetic, which is very important. Also monitoring pain with a patient, monitoring heart rate, blood pressure, oxygenation levels.
Mm.
We do a lot of icing. We do a lot of elevating with patients, with it being all bone and joint related, but it's stabilizing a patient post-operative and then being able to teach and educate. That's a big part of our role, as well as education of the patient and also their family members on how to take care of the patient once they do leave.
Wow.
Mhm.
Yeah, that's fantastic. It sounds like you really love what you do and you're very passionate about it, but are there some things that you don't like about your job? And what are some things that you do love?
Sure. So fortunately, with COVID hitting, I don't work in a hospital setting. So I'm not really inundated with all the COVID patients, that sickness that I can't imagine. Right now, what I really like is that for the most part of my job, it's still different every day while still utilizing my skills that I learned. I enjoy working with the other nurses. You have to have a sense of humor in nursing. That goes for nurses, doctors, CNAs, everyone. You can't be serious all the time because it'll get to you.
Yeah.
So I do like that. It is rewarding when someone says thank you. It doesn't happen a lot, but it does happen. And then the things I don't like, obviously, demanding. Again, you're working with people at their worst. They're sick, they're in pain. The patient's families maybe not ready to take them home and take care of them. So it's demanding and it's long hours. I mean, you just because you're supposed to maybe leave at 2, well, you don't leave until everyone's gone. So it can be long hours, just demanding. You have to have an outlet in any medical field, with a lot of bad that can be in medical field.
Wow, that's amazing. Yeah, that's really good to know. I think it can really wear you out after a while, but that's
It
really
can.
advice.
Yeah.
Mhm.
Yeah.
So, what are some advice for our students considering this career path?
Well, again, medical, I mean, nursing is still an increased profession. They're still
Yeah.
forecasting it being an increase in up to like 2028, I think 12% increase
Yes.
every year. It's a very demanding job.
Mhm.
I was always told you can get a job anywhere. You really can. It might not be exactly what you want from the get-go, but kind of like how I did it, you kind of see the progression of where you can go, get good grades in school. It's very competitive in college. I will tell you, when I went back, I think I was 24 and I was competing against probably 19, 20-year olds. And that was the number one question on a test. What did you get? What did you get?
Mhm.
Very hard to get into nursing college. So get good grades, study biology, chemistry, You have to do those, getting good grades so you can get into the program, and then you'll be home free. But it's getting in. It's the hard part. It's the most competitive part. You'll be set for life with a job anywhere you want to go.
Fantastic. That is so true. I feel like the medical field is ever growing and
Oh yeah, always will be a need for medicine, so that's always a good option to go into.
wonderful. Well, thank you
Mhm.
so much for your expertise. And I know you have some information that you would like to share also with this with the students. So yeah, go feel free.
Oh, sure. So this is just a quick PowerPoint. I'm not going to go through every single slide. Our career options, there's 4 different areas you can go into with nursing: the nursing assistant, an LPN, a registered nurse, and then one step further would be a nurse practitioner. So those are great areas to get into. Again, that CNA position, I think you have to be 18 in the state of Wisconsin to actively have that certificate and work. But yeah, absolutely. Start as a CNA. That's going to give you an actual good overview of what you want to do if nursing is it for you. Okay.
So yeah, I have a question about being a nurse practitioner. What is that
Yeah.
exactly?
So a nurse practitioner is going to be going probably another couple years after a registered nurse. You do have to hold a bachelor's degree before you can be accepted into a nurse practitioner program. They're going to have more responsibilities, but they also have more, I want to say, rights. They can write prescriptions.
Okay.
They're going to be working more so with a doctor, with an actual physician, and they can see patients, diagnose patients as well. As nurses, you can't diagnose. You can treat based on what a physician diagnoses, but we can't diagnose, we can treat.
Gotcha.
Mhm. And so, yeah, there's a CNA position. Again, it's helping a nurse out. I was always told in nursing school, never get on the bad side of a CNA because they will make or break your day. And that is completely true as I've gone through my career. Have a great relationship with our CNAs. So they do the grunt work. They're going to taking patients to the bathroom, taking them for a walk. Sometimes they're doing vital signs. Sometimes they're helping them get dressed and eat. They do a lot of the grunt work.
Mm,
But if they don't, it's on the registered nurse who they're working with. So don't get on their bad side
mhm.
ever,
Good to
ever.
know.
But yeah, these are just some of the responsibilities of what a nursing assistant has as you go down there a little bit. So that's a lot of their responsibilities and duties, what they can do with their certificate.
Oh,
Average salary about $12 an hour. I think the ones where I work are probably more about 14 to 16 an hour, but
mm,
yeah. And then LPNs work under the direction of an RN. They can still do a lot of the responsibilities, but they're not the RN. So they're just a little bit one step under, again, their delegation skills, maybe to a CNA, but LPN is if you want to get in and be working right away. And there's their pay, which is always important, $18 to $20 typically for an LPN. Looks like it's about a 12-month program. So you can become an LPN in about a year.
nice.
Yeah. And registered nurses, again, there's 2 of us, 2 pathways, bachelor's of nursing and associate's degree nursing. Same tests, same boards we have to take. It's called the NCLEX to become registered, but a bachelor of nursing has a lot more potential to grow in their career, but doing a lot of the same duties. And then our nursing about $30, 31 an hour, depending on where you go.
Wow.
Yeah, so that just goes through the bachelor's again. And oh, this might be good actually, because this slide here does talk about what you're looking at for schooling, what you need from the GPA, the math, chemistry, biology. So that's for a bachelor's degree. And then here's your nurse practitioner. And they do now have doctors of nursing. So I do have a friend who did go back to become a nurse practitioner, and she ended up being a doctor of nursing. So that is something new. Probably in the last few years, we've seen that more.
Interesting.
Yeah, and you can see they make a lot of money. Nurse practitioners can make up to 6 figures easy a year. Absolutely.
Awesome. Well, thank you so much. That was
Yeah, absolutely.
good information. Rebecca, well, thank you so much again for your time
Yeah.
and just the knowledge that you've given us. Yeah, if anything, if students, if you have any questions for Rebecca later on, if you decide to, I have Rebecca's email, so feel free to just email
Yeah,
me and I will relay the message to
for
Rebecca
sure.
and I can connect you guys with with anything that you might have, okay?
Yeah,
Well, thank you.
wonderful.
And yeah, okay. Well, you have a
All
good
right.
day.
Thank you too.
Thanks, everybody. Bye-bye.
Bye-bye.